Okay, so we're going to move on to session 46, Adult Education and Community Outreach. Part of some of our jobs is to go out into the community, Boys and Girls Club, Rotary clubs, and do community education. That doesn't happen for a lot of people. That's more a program director and development director activity, I think. But we do family education, and a lot of what we do in our groups, our psychoeducational groups, is adult education. So one of the things that we need to know is really how to help people learn best. We're going to define learning, identify assumptions about adult learning, which I'll put in my 2 cents here, I think applies even to kids. My son would tell you that. I try to teach him out, well, we go through algebra, and he's like, when am I ever going to use this? So I think even kids want to know how and why it's applicable and why they need to know it. Explore ways to motivate learners, review learning styles, and learn a new skill to use in community outreach, family education, and therapy groups to improve learning. So if you can get one new skill or new idea out of this, then it'll be a good hour. So learning, and we haven't really defined this before, it's a change in behavior. We're changing, if we want to learn how to garden, it's changing our behavior so we can learn how to grow things. If we want to learn how to speak Spanish, it's a change in our verbal behavior. It's a change in knowledge or skill. So for most things, in order to change a behavior, we have to change our knowledge or skill in a certain way. If I wanted to learn how to play football, that's a change in behavior and knowledge and a whole lot of skill. Acquiring new information and knowledge is part of everyday adult life. I think it's part of everybody's everyday life. And I really encourage, whether it's the adolescents or my children at home or adults, learn something every day, even if it's just a little something. Learn something every day. Adults seek out learning opportunities. And children, provided the right environment, often will too. That's why I think Montessori and some of those other self-directed learning opportunities really encourage kids to explore and find different things. If you take a kid to a museum, most of the time, they're going to go around and look at different things and get this like wide-eyed look and seek out those learning opportunities. Very rarely will you have a kid walking around going, this is boring. If nothing else, they're looking at the visual exhibits. Learning is an individual process. I'm going to be interested in learning some things that you aren't interested in, and vice versa. I learn a different way, maybe, than you do. So it's what motivates us to learn, what we care about learning, and how we learn it may differ between people. Imagine that you want to learn a new skill or content area. What triggers your desire to learn?
Different things. Maybe a novel concept that is kind of interesting, I never considered, or future rewards, or mitigating past.
That could be true too. When I think about what triggers me to learn, it's usually a need. When, let's see, four years ago? I think about 4 years ago, my daughter decided she wanted to learn how to crochet. I hadn't picked up a crochet needle in like 20 years. So I felt I needed to learn it at that point. That triggered my desire to learn crochet again, which I hadn't thought about in 20 years. The gardening. I didn't want them exposed to all the pesticides and everything, and I'm too cheap to go out and buy organics, so figured I'd grow it. Triggered my desire to learn. So money and need usually trigger me. But novel concepts, definitely something to think about, or just maybe a hobby, maybe a change of pace. or something maybe someone you care about is interested in. How would you go about learning it? What would be the first thing that you would do to learn something, a novel concept?
Seek out an expert.
Okay.
An expert source.
Okay. So you would seek out an expert. I'd go to the library or get on the internet and find some sort of reliable resource to read about it first.
Well, that's what I meant.
Oh, okay.
Any type of knowledgeable source.
Right. So finding some knowledgeable source to help you get information about it, and then figuring out how to implement it, and identifying what might get in your way. So if, example, I wanted to learn how to build a one of those stone ovens for outside, and
oh, that's cool.
Yeah, it is really cool. I haven't got the arm strength, the patience, or the artistic skill to just kind of take a book and go do it. So what might get in my way? If I don't have a master craftsman working with me, I can pretty much guarantee I'm going to screw it up, and it's going to be in concrete and there forever and always in 100 years from now. So it would help me to have somebody there. When I was learning how to crochet again, the YouTube videos were helpful because I'd watch a step, I'd pause it, I'd do a step, I'd unpause it. I don't watch an entire video and go, oh, okay, I got it now, and go on my merry way. So breaking it up into segments is helpful for me. So we need to ask ourselves and our patients how they learn best and what gets in their way. And I guess we'll talk about that some here. Adults learn differently depending on their experience, aptitude, and attitude. If they have experience with it before and it's gone poorly, for example, calculus, I'm going in probably with a bad attitude, going, I can't do this. I couldn't do it when I was in college. I can't do it now. So if we're taking somebody who's been through treatment before, and they've already heard this information and it didn't do them any good, then they're coming in with that kind of a bias. If we can say, all right, you've heard this information, now let's figure out how to make it do you some good. So let's change their attitude about it a little bit. And aptitude. Not everybody is good at everything. Yeah, calculus or stonemasonry. So we need to include individual characteristics like cognitive abilities. We also need to include for our clients any side effects of medications and where they are in sort of the detox recovery process. If they're still in post-acute withdrawal, they're not going to retain near as much as somebody who's been clean for 3 months. The perceived value of the learning task. If it's important to them, they're going to be more likely to learn it and solidify those pathways. If it's something that they have to regurgitate, or they don't even have to regurgitate, it's just a class they've got to sit through in order to get out of treatment, they may not even engage. So we want to make it valuable to them in some way. And sometimes, thinking about professional education, sometimes it's a class that you have to take because the state or CARF or JACO says you have to take it, and you're like, oh, please. Ethics, every year. Every year they tell you don't sleep with your patients. It's like, really? That hasn't changed. But, so we have to take that class. The value is we keep our license. But to get people engaged, because they're like, I've heard this all before, and, I've got other things to do, I need to answer my email. Figure out how to make those 3 hours or whatever it is valuable to them. Make it a social activity where it's fun, where they get to talk with their coworkers and stuff. Have some activities, break it up. Figure out a way to increase the value by increasing the intrinsic reward. Whether, it's more fun, maybe you bring food to it, that always gets people there. When I was a resident assistant, if we had a activity on our floor, if we had food, we knew people would come. The perceived value isn't necessarily the learning itself. So we need to figure out how to make that learning enjoyable, fun, and rewarding. And how much experience they've had with the topic in the past. If I walk into a classroom on woodworking, I have just enough woodworking experience to be dangerous, literally. So when I go into an industrial arts class or something, I don't have a lot of background knowledge. I don't have a lot of memory pathways that I can, tap into and go, oh yeah, this makes sense because it's light, this, that, and the other. I'm just like, huh? I just want it to not fall down. Starting to talk about angles and corner braces and so if you're giving somebody too much knowledge and they have nothing to relate it to, it's going to be harder for them to learn. So pace the knowledge and help them relate it to something that they know. So assumptions about, theoretically, adult learning, or just assumptions about learning. People want to know why they need to learn it. So provide either an introductory story or an anecdote or a vignette that helps people see how or why it might be useful to them. Discuss how it'll be helpful. If they're in a class on documentation, that's a real snoozer. So what is it that you're going to learn in this class that might actually help you do your job more efficiently, get your documentation done faster, because I know none of us want to do more of it. Point out why it's meaningful. Adult learners are active, responsible learners and need to be self-directed. Most adults have gotten pretty used to making their own decisions. So if you're treating them like they are second graders, a lot of times you're going to have two reactions. Most of the time people regress and start acting like second graders, and that's not helpful. Sometimes people will rebel because they are not self-directed. What we want to do is encourage them to ask themselves, what might you be able to get out of this? So at the beginning of the class, if you're doing a seminar, if you're doing a family education group, what is it that you hope to get out of this? So they're providing information about what they want. That's sort of self-directed. They're directing you what to tell them. And they have a need to apply the material. So whether you're doing a family education group on communication skills or identifying addicted behavior, help them apply the material. One way you might do it is play an episode of The Simpsons or some other show where there's clearly dysfunctional characters, and have them identify addictive behavior. Do a little psychoeducational thing on addictive behaviors about manipulation and blaming and all those other things. Have them watch The Simpsons and periodically stop it and say, do you see any of the addictive behaviors we talked about in Homer? Have you seen any of these same behaviors or anything like these behaviors in your loved one? So put it on something that's less threatening so they're not calling out their loved one. But then you can bring it back closer to home and go, now think about whether you've seen some of these similar behaviors in your own household. And you'll see them going, mm-hmm. A lot of times during the video, they'll be going, that's you, that's you. So sometimes they are calling people out. Being creative, because just straight lecture doesn't necessarily appeal to everybody. Some people prefer to write it down, read about it, apply it to their current situations. Bring experience to learning. They come having certain experiences, certain biases, and certain knowledge. We want them to share their knowledge, and we want to be aware of their biases. I think every counselor has different tools that they can bring, different perspectives that they can offer, and it's certainly worth hearing those. All of our families have different tools and different perspectives. And it's taking all this knowledge and figuring out how to make it work for them instead of against them. One of the things you can, well, we'll get onto that in a minute. Adult learners are ready to learn when the need arises. So how can you make mandatory learning more relevant? And when I say mandatory learning, I mean like in-service training for CPR.
I just went through CPR again. They brought up a couple of incidents that had happened in our hospital where people were, because it had been so long since they had taken, we don't really use it all that often. I mean, very rarely, as a matter of fact. And their confidence level was not good. And so just showing how it can, we can be in that, even though I'm in a psych hospital, it can be useful.
So pointing out how it is currently relevant in recent situations where CPR could have been used. Pointing out, okay, maybe you're not going to use it that often at work, but maybe you need this knowledge so if your grandma comes over and has a heart attack. So make it relevant. Why do I care to refresh my memory on this? Because there are people around me I care about. There are people who may fall out. And if I have the skills, then I can save a life. Woohoo. Increase rewards for learning. Obviously, providing salary incentives and those sorts of things. We've all been to conferences before where they throw out candy or food or some sort of bribe to people who will answer questions. At least that keeps people engaged. Provide task or problem-oriented learning. And in my view, this is kind of a reward in and of itself, because it's helping me take this information and apply it to something that is meaningful in my particular situation. For example, this adult learning. When I was working in the clinic, I didn't do a lot of adult education stuff, but I did do a lot of family ed. So we would talk about how do you use this in a situation when you've got 3 families that are there trying to learn about addiction, because it can be a really dry topic. How do you help them identify it in a way that is non-threatening, but is poignant? So one of the things that we might do is talk about diagnosis. Problem-oriented learning would be breaking the group up, giving them a vignette. Everybody actually has a different diagnosis, and having each group diagnose their patient and then come up and explain to the rest of the group how they arrived at that diagnosis. It doesn't always have to be a lecture situation. It's actually, if you can break up into groups, it can be a lot more impactful. I remember one of my classes that I had in graduate school, our final exam. He handed out the final exam and he said, okay, now everybody break into groups of 4. And we broke into groups of 4 and we all completed our own tests, but we got to talk at our table about which answers were right and our rationale. And I learned more from that 2-hour session than I think I learned the whole last half of the class. Communication skills, coping skills, these are all things that we can encourage patients to practice. They can do little acting out scenarios. They can teach portions of it. And they can also, when you can teach the communication skills section, 10 minutes, whatever it is, and then say, let's look over the past week, and I want everybody to give me an example of when they use aggressive communication, and let's replay it using assertive communication. Coping skills, the same sort of way. There are 4 elements of learning. Motivation. You've got to be there emotionally, want to learn, need to learn, and be ready to learn. Reinforcement. Positive. You can give people points in a therapeutic environment. If you're on a token system, people can earn extra points for what they do. Even in outpatient, we had clients who earned points, and then at the end of the week, we had a cabinet, and they could cash in their points, or they could choose to carry them over, and each shelf on the cabinet represented a different point level. Negative reinforcement would be, for example, an early break. If we get all this done, as soon as we get all this done, you guys can have a break. Now that can take us 2 hours, or we could be done in 45 minutes. Most of the time, people kind of pull it in, and you get done in 45 minutes. So negative reinforcement is taking away something aversive. Whether you consider it positive or negative, again, food, if you have it catered. That used to be one thing, the place I worked at in Florida. Whenever we had a big meeting, the cafeteria would cater it. Oh, those women can cook. Retention. Learning something for 5 minutes is good, but it's not going to do you any good unless you retain it. So you want to do multiple sensory presentations. And there's this triangle or cone of learning that there's a lot of debate about. But basically, the short version is, if you learn through one method, you're a lot less likely to retain and solidify those memory pathways as if you learn through 2 or more methods. So if you read it and then you come to class and you hear a lecture on it, or you talk about it, or you read it and then you do a worksheet on it, you're going to be more likely to remember it. You also retain it more if you practice it and apply it to something in your real life. So when you're doing family education, you may ask for a situation that has been a problematic in their family. Maybe John's in recovery and he seems to be being secretive lately, so how do I handle that? I'm wondering if he's using again. How do I approach him? So you can talk about that and you can rehearse it in group. You can discuss the skills that might be needed to address those things. And then transference and generalizability. Talking to John about his new behavior that seems to be somewhat deceptive or manipulative, that's a hard conversation. It takes tact and courage and a lot of assertiveness and controlling your emotions so it doesn't get aggressive and heated and that kind of thing. So how can you also use that in other areas of your life besides with John? Transference and generalizability is something you can talk about also the following week and say, last week we talked about being aware of extreme thought patterns, dichotomous thinking. So I want you to tell me how that changed the way you did things or the way you thought about things over the last week, not just in your relationship, but at work and with your kids or whatever. Encourage them to try applying it in different situations so they don't get stuck in one thing. The context of learning is also important. A positive classroom climate, and this group room, seminar, meeting room, whatever, classroom is kind of general. Creating a positive environment, it needs to be somewhat comfortable, but not so comfortable that people fall asleep. It needs to have a decent temperature. It needs to have adequate lighting. Lights that flicker if somebody has a seizure disorder can trigger a seizure, so it's important to be aware of those sorts of things. But it also needs to be psychologically safe. A lot of people are not going to be comfortable sitting in a group therapy session, if there's an entire wall of windows, so anybody who walks by can see who's in there. You know, it's disruptive. So we want to create a positive climate. We also want to create an attitude of respect, where we're not necessarily the expert talking. We want to get feedback from the patients, feedback from the families. What have they tried? What have they done? The climate for families versus patients. Do you think it needs to be any different?
I know it's not different in my facility. I don't know, my only thought on that is that, you know, patients are there day after day after day, and they get used to who's there. Family coming in, they may come one time, and so they're not going to be as accustomed. And so I would think you're just going to have to work harder to be more friendly and, you know, make it more accepting and accommodating.
So trying to make it as welcoming and non-threatening as possible. Now, if you've got families coming in, you also might have the issues, well, there are a lot of different issues, but people of different ages, people of different belief systems. So there is something of a difference that we need to consider if we know we're going to be having teenagers all the way up through grandparents coming in. Negative classroom climates are really accusatory, blaming, and disjointed. I'm going to talk at you, and then you're going to say thank you very much and walk out. There's not going to be interaction. There's not going to be discussion. People aren't learning that way. Student characteristics also affect the context of learning. Whether they believe they can learn. If they believe they can learn and they believe what you're teaching is going to help them in some way, they're going to be more likely to learn. If they've gone through your program 3 times already and relapsed 3 times already, we need to address that self-efficacy, because they're probably sitting in there going, I'm just in here while I dry out, because I've heard it all before. They may have heard it, but they haven't applied it. So what we need to do is help them see how not only they already have the tools, but they have the ability to apply it. We just need to kind of nudge them to figure out how to do that. What their expectations are. If they walk in and they expect for some big stuffy person in a white lab coat to come lecture them about the disease of addiction, they're going to have a much different attitude coming in than if they expect to be in a roundtable discussion. I mean, my expectations when I was in college, I had one class that was in a lecture hall of 700, and I had one class that was in a conference room around a roundtable. Very different preparation for those classes, I mean, or lack of preparation, but I digress. We also want to look at vulnerabilities and confounding issues of our students. Do they have cognitive issues going on? Are they in crisis? Are they detoxing? If so, it's going to make it harder for them to learn. Some things that we can do to mitigate this is write things down. That way they can take it in smaller chunks. Shorten the class periods. That way they have smaller chunks. And identify with them what might help them retain the material a little bit better. Peers in our groups and in family education as well, stage of readiness for change is huge. If you take somebody, let's talk patience for a minute, and you have some who are in action and some who are in pre-contemplation, it's going to be a somewhat adversarial climate because these pre-contemplators are probably going to always have some sort of a smart comment, and the people in action may get frustrated. So you're going to spend a lot of time trying to keep them on task. Family education, similarly, you have those families that believe in that whole identified patient model. He's the problem. You need to fix him. There's nothing wrong with me. And then you have other families that are like, I'm here, what can I do? Our family is a mess. Very different approaches. So we need to figure out how to help these families get the information in a way that's meaningful to them without creating tension and adversity between them. Co-occurring issues in peers. If you've got
people with personality disorders.
Yeah, people with personality disorders, that never helps. Or even people who have chronic pain. One young woman that was in one of my groups, she couldn't physically sit for an hour at a time because she had back problems and stuff. She would sit at the back, and so she could get up and stand behind her chair. She wasn't disruptive at all. But there have been circumstances where people have had similar issues or they've been uncomfortable, so they've been switching, and they've got constant pain, and it ends up disrupting everybody else. Or worse yet, they're taking painkillers, and they're triggering everybody in the room. So we need to pay attention to co-occurring issues. And culture. Not every culture is comfortable in group therapy. Not every culture addresses things the same way. So making sure that peers are comfortable with one another and there's not biases, prejudice that is bleeding in and disrupting the flow of your group. And then community. Stigma and attitudes in the community that prevent people from seeking help or prevent people from seeking support once they get out of treatment is going to be important. We need to ensure that the community understands that all drug addicts aren't criminals who knock off liquor stores and prostitute themselves. We have television stars, we have music stars, we have very powerful executives and CEOs and mayors who have addictions. So it's not a one-size-fits-all. It doesn't mean we can't just characterize people because of an addiction. And the availability of peer support. Somebody learns this information in group, which is great, fabulous. They retain it, great, fabulous. They get out of treatment, and there is no social support for them. They don't use it, what happens? They lose it, right? So the availability of peer support is really important. And the first thought is, well, everybody has AA meetings. There's AA meetings in every town, borough, and precinct everywhere, which is true. However, if AA doesn't work for them for some reason, or if those AA meetings are not welcoming for some reason, then we need other alternatives.
Yeah, plus some meetings are better than others.
Some meetings are much better than others, yes. And significant other expectations. If the significant other is constantly saying to the identified patient, why aren't you fixed yet? What's wrong with you? Then the patient may start to doubt their own efficacy at learning and doing the next right thing. And if the significant other believes, again, in that identified patient, it's not me, it's him. So as soon as he changes, everything will be fine. Well, he changes, everything's still not fine because it's a dysfunctional system, but we're still blaming him. So there are a lot of things that can go into learning and set up people's expectations for their success and ability to master the material. So there are 6 factors that motivate adult learning. Social relationships, to make new friends, to socialize, to hang out. External expectations, job, school, or other authority like our licensure department, requirement to get continuing education. Social welfare, to improve the ability to serve the community, whether it be through first aid or maybe volunteering at the Red Cross or something, where you have to take certain classes to help out. Habitat for Humanity. Remember I said I knew just enough about woodworking to be dangerous. You wouldn't want me working out there. Paint, I can do. Personal advancement, professional advancement, or to stay abreast of competitors. Escape or stimulation, to receive boredom or change the routine. And cognitive interest, just to learn for the sake of learning. I love to learn. I love to go to the library. I love to read books. Not everybody necessarily does. Not everybody learns by reading. So it's important to help them identify what motivates them to learn so they can continue to learn. Make it positive by injecting humor. I did a presentation to a bunch of cops, and we were talking about unit cohesion. And I said, is your unit more like Homer and Bart or the Waltons? And, you know, that was very poignant about the relationships because they're so dichotomous. Use video clips that may illustrate a point and then tie it into the current situation. You know, we can see Homer having anger management problems here, but what does that mean in terms of dealing with civilians when you go out on a call? What does that mean in terms of dealing with your significant other when you both are having a bad day? Use anecdotes and fun activities. There are a lot of things you can do that are really pretty amusing to teach different skills. If you have a group of people, you can go around, even things as simple as breaking people into groups and having those easel sheets and having them answer different questions. And then you go around and talk about the answers to the different questions. But every time I've ever done that, I've had people in the group trying to guess who wrote which answer. So they're like, oh, I bet you wrote that one. And it turns into something that's pretty fun with people kind of calling each other out gently and anything to break it up. Don't forget learning styles, visual, auditory, and kinesthetic. Use easel sheets and encourage people to teach, enact, or apply to prior experience whenever possible. Number one, it takes the load off you if you can have them teach. But it also helps them because you don't know what you don't know until you try to teach somebody else. Have them act it out. Some of our clients are real drama kings and queens, and they enjoy acting and hamming it up. Great. Have them do a little skit. And a little bit more run-of-the-mill, have them apply whatever you're talking about to prior experience. When could you have used this in the past? Or how might this help you in the future? Remember that active learners tend to be more extroverted. They don't mind interruptions, and they like to talk it out as they think. Reflective learners tend to be more temperamentally introverted, where they like to reflect on it and then share with you. They both work at about the same pace, but they just don't do it quite the same way. Intuitive, people who are temperamentally intuitive tend to need that global presentation of things, an overview of what's going to happen. We went to see Despicable Me 2 last week. And I couldn't wrap my head around it because I didn't have the background and the big picture. And I'm sitting in the movie theater trying to find the wiki on it to try to figure out who all these people are and what the plot line is and what it's supposed to be about. Obviously, I'm sort of a global person. I like having that big picture. I look at the puzzle box when I'm doing the puzzle. People who are more sensing like the details, and they don't need as much of a big picture, but they do need details. Feeling versus facts. Not everybody likes a pure factual presentation. I had a professor one time who, it was his first year teaching, God love him. It was developmental psychology, and every single day on the overhead, you know, it wasn't even a PowerPoint, on the overhead was slide after slide of research articles copied directly out of journals with percentages and alpha coefficients and drool.
That's too bad because that's such a fun class.
I do love developmental. So, but some people might, especially if that was before I really discovered and understood statistics, but some people may have really, really enjoyed that. I need a little bit more feeling in it than just peer-reviewed journals. So you want to have a nice combination of facts plus real-life experiences so people can connect with it. And then provide a menu of options and structured. One of my professors used to provide a list of things. He's like, this is the syllabus, these are the things that we've got to go through. And this is the suggested set of activities and way you learn it. However, if you don't want to write a paper, you can instead do this. So he did give options for some of the bigger projects, which a lot of the students liked because it gave them the opportunity to choose what they honestly thought was easiest. But whatever.
As long as they learned.
As long as they learned, it didn't matter.
Why does it need to be harder?
So we want to provide enough information to help people learn, but not too much where they're overwhelmed. Allow students to work collectively. I may say something 6 times, and you still look at me like, huh? And Sally over here says the same thing, just with different words, and you're like, I got it. Allow people to work collectively. They may share different, ways of saying things. They may share different experiences where it's more meaningful. Emphasize the immediate benefits. For a lot of people, learning is not its own reward. So we're learning this. What are the immediate benefits to adult education? Increase patient satisfaction, which increases engagement, which reduces premature discharge, which makes your boss happy, and we're all happy when our boss is happy. Small activities provide learners an opportunity to share, reflect, and generalize their learning experience. And it also just makes them feel happy. A lot of times, I taught an undergraduate stress management course, and there were usually 75 to 120 people in that class. So we would break up into groups of 8 or so periodically throughout the class. And they would do whatever I asked them to do, probably in the first 10 minutes, but I would allot them 20 minutes, and they'd spend the last 10 minutes getting to know each other and sharing a little bit. And theoretically, it's somehow tangentially related to what we were talking about, but it was one of those, it was a positive reward if they got their work done, and then somebody would have to stand up from the table and share what they did for their assignment. So I knew everything got done, but it was more enjoyable than everybody sitting at their desk by themselves filling out a worksheet. Promote autonomy and innovation. If there's a concept that you don't really know how to teach in a way that's engaging, ask them. How do you think we could present this topic to family education on Wednesday night? kind of a dry topic. We're going to go over pharmacology. So how do you think we could present it in a way that might be fun for your families because they've got to sit through it? Come up with your ideas. And I will see you in 20 minutes. You'd be amazed at the kind of innovative, creative ideas that people come up with, especially the ones who haven't gone to school to be educators, because they think outside the box without going, oh, I can't do that. They're just like, hey, let's do this. And a lot of times it's really fun and cool. Stress order through consistency, fairness, and respect. Promote involvement in group governance through shared values, needs, and goals. Now this is important, especially if you've got groups where there are different thoughts about how addiction develops, or they're in different stages of readiness for change. The group goal is to learn this information and get out on break. Hopefully it's more than that, but for the pre-contemplators, that's where we're at. So how can we make that happen? Your people who are in the action stage really want to learn. So you might encourage them to stay after during break, provide additional enhancement activities that they can do after group. So you provide the information, get everybody there. Don't keep the pre-contemplators longer than they can actually tolerate, but make sure that the people who are really wanting this information can take it, rehearse it, and apply it and generalize it. Make sure to differentiate between the behavior and the person and encourage them to do that. Too often we still hear the vocabulary in groups. You're such a pain, or you're so funny, or you're such a goofball, or you are, instead of that behavior was. And in residential, we hear a lot more condescending, negative, general comments. But encouraging them to identify behaviors and communicate assertively. Regularly assess attribution statements to make sure they're not too global and stable and negative. Model positive attitude, empathy, and acceptance. I was talking earlier about losing my keys. I lose them all the time, and whatever, it's kind of expected in our house. And so I put this basket, I got this basket at Goodwill, and I put it in the foyer on the table so I could put my keys in there. And I was walking around the other day looking for my keys. Couldn't find them. In basket. And my daughter stops and she looks at me. Now remember, she's 10. She goes, well, how are you supposed to find them when they're put away? Oh. And I'm like, I know. So we laugh at ourselves. We model a positive attitude. We all make mistakes. We can learn. We can modify our behavior. And we accept each other and our fallibility and all that kind of stuff. And reinforce the inherent worth of all participants. They may not be the smartest. Maybe this is their third relapse, but they're still worthy human beings. They just need to strengthen their tools a little bit more. Develop collaborative and cooperative learning activities. Seize opportunities to teach conflict resolution and stress management. When you see that one person over in the corner of the class going, I'm going to freak out, it's a good time to teach conflict resolution or self-soothing or stress management. I noticed in some of my groups when we would have people who had some impulse control issues, they would blurt out, they would talk too much, and 80 people living in a small environment, 80 grown-ups living in a really pretty small environment. After about 10, 15 days, they started grating on each other's nerves. So during group was often a good time to help people learn how to self-soothe, de-escalate, pick their battles. Teach how to accept and learn from mistakes. Demonstrate how to build on their strengths, and help others view patients and family members positively to encourage future learning. If the family members start viewing the patient positively, instead of the screw up, the black sheep, the addict, it will encourage them to try to do the next right thing. If they see them as the screw up, the addict, the person who's going to relapse again, it kind of encourages past behavior instead of future learning. Likewise, too often we put the family members on the spot. We have to have the client do the same thing. They need to encourage their family members to learn to trust them, to learn to communicate effectively. So they both need to learn. Barriers. Adults, evidently, are more sensitive to discomfort than children. Temperature, hunger, thirst, noise, light, seating, and duration. So we want to make sure that we keep things tolerable. If you've got a group that's in early withdrawal, if your organization allows it, maybe do a 30-minute group with a 10-minute break and then a 30-minute group instead of an hour group with a 20-minute break. It really depends on what's going on. Sometimes on nice days, we would take everybody outside and we'd have group under one of the trees that was outside. Number one, because it was always uncomfortable in that building. If it was hot outside, it was subarctic in the building, and vice versa. So we would go out there and get a change of scenery, change of noise, some nice fresh light. And then they could also get up and walk around and move. And generally when we were outside, we did more movement-oriented stuff than in the stuffy old group room. So adult learners are more likely to retain relevant information. Learning is an emotional, cognitive, and situational process. So create the right situation, make it meaningful, and present it in a way that they understand, and you're golden. Psychoeducation and family education groups can be improved through the use of principles of adult learning. Too often we get stuck in our routine. I know I do. Where I'm like, okay, today is session 13, and we're going to go over stimulants or drugs of abuse or something. And I go in and, you know, I have certain activities I do and this and that. It's helpful to be a little bit more flexible and open to trying different things. One of my colleagues suggested one time, and it was a great suggestion, you have your preferred, you know, this is plan A. But then also have plan B and plan C in case plan A starts falling flat. Because too often I've had these great ideas, and I can see how well it's going to go, and I get in there, and they're looking at me like, really? So try to be flexible, try to have alternatives, and if you only have plan A and it's falling flat, try asking them, what is it about this topic that might be useful to you or that I might be able to help you understand a little bit better? Because maybe you're just telling them something that they already know. So that is that.